Hey, future medics. Today we're talking about a topic that confuses a lot of students, but it is incredibly important to understand, and that is intraperitoneal organs versus retroperitoneal organs. The difference is that some organs sit inside of the abdominal cavity and some of them sit behind it. And that is important for how pain presents and where bleeding hides. But we talked in the last video about the abdominal pelvic cavity and how it is lined by the peritoneum. So there are two layers, and it is that thick, slippery membrane that protects our organs. So the parietal peritoneum lines the inside of the abdominal wall, where the visceral peritoneum, it coats the organs themselves. And the space between those two layers is the peritoneal cavity. And in this cavity, there is serous fluid which lubricates movements of these organs so that they don't rip and tear. If an organ sits behind the parietal peritoneum, it is a retro meaning behind, retroperitoneal organ and not an inside, intraperitoneal organ. Intraperitoneal organs are fully surrounded by that parietal peritoneum. They're also very well protected by that insulating omentum layer. These organs that are intraperitoneal are the stomach, liver, spleen, most of that small intestine, and the transverse and sigmoid colon. Now, because these are very vascular, whenever these organs are injured, they cause internal bleeding, which irritates that lining and often causes peritonitis. Retroperitoneal organs sit behind that parietal peritoneum. And because of this, they're almost like pressed up against the back of the abdominal wall. They're still in the abdominal cavity, but they're way in the back and they don't have much room for movement. So these organs include the kidneys, adrenal glands, most of the pancreas, the duodenum, ascending and descending colon, and the aorta and inferior vena cava. Now, because they are behind and not in that main chamber, we can have a lot of bleeding to this area before anybody notices because it doesn't cause that rigidity and distension we're used to seeing with abdominal bleeding. Here's why any of this matters in the first place. Retroperitoneal organs don't irritate that stomach lining, so we don't quickly see internal bleeding with these organs because our normal signs that we look for don't work. So our patients often look stable and then suddenly tank out of nowhere and we're not really sure why. So this will help you have some clues. When you're doing your abdominal assessment, also think how deep pain is versus just exactly where it is. How deep is it going? If it's radiating to the back, that is indicating the involvement of retroperitoneal organs like the kidneys. But if you are seeing that abdominal rigidity and distension, that's going to be an intraperitoneal organ. Knowing this difference knows it helps us to know where to look, but also what organs could possibly be involved. And then we get to thinking which ones are hollow and which ones are very vascular. So which ones are going to be more life-threatening. So when you hear abdominal trauma, I want you to start thinking more three-dimensionally and turning things over in your mind. We're not just thinking of the front, we've also got organs in the back that need to be considered. Now, knowing where these lie lets us know that there can be some injuries and internal bleeding that go unnoticed. And knowing to look for them in the first place is half of the battle. And this allows us to find injuries quickly and almost anticipate injuries instead of chasing our tails and chasing the effects of that injury. Now, I know this feels like a lot, but we're building it little by little, and that's how you're going to get mastery. You're doing fine. I know you are. I believe in you, even if you don't believe in yourself right now. I'll see you soon.